So what is body contouring? It sounds like a nebulous term, but it really reflects what we're trying to do. So our bodies are shaped differently. Men and women are shaped differently. Men tend to accumulate more fat in their abdomen, women more hips and thighs. But even individual genetics, we might have that one stubborn spot where we fundamentally have a higher collection of fat cells in a certain area that we kind of inherit. No matter what, with diet or exercise, we can't get rid of that little bulge. And that's what body contouring treatments do. They are getting rid of unwanted little bulges. So they're not really weight loss treatments. We can do contouring where we can get rid of bulges and your weight can stay the same. And sometimes for patients, the weight actually increases, but we've shaped them better. And how do we do that? Well, we can destroy fat cells in certain areas where we don't want it. And what the body does when those fat cells are gone, it doesn't replace them. It just distributes that fat elsewhere to the other cells in our body. So as we get older, we don't create new fat cells. Our fat cells are relatively fixed. So when we gain weight, they just get larger or they get smaller. But those bulges tend to have a higher collection of fat cells. So if we get rid of a few ones in those areas, then we can get rid of that bulge. The other thing is we want definition. So contouring now has evolved because we have these new non-surgical ways to increase muscle tone, which can give us definition contour where we want it, like abs and tighter buttocks and thighs. And so these are where non-surgical ways we can do it. Now you can do surgical contouring with liposuction, but not everyone wants to have the surgical procedure to undergo the anesthesia, put themselves at risk for complications that are unwanted during a surgical procedure. So we have a full suite of non-surgical body contouring treatments.
You kind of need to look at the causes of that problem in order for you to get the best effect. And oftentimes a bulge in an abdomen, for example, is the result of poor muscle tone, as well as a fat accumulation, as well as skin laxity, possibly after pregnancy or something. So, looking at all three layers of muscle, fat, and skin is an important evaluation method to really address all three will get you the best results. So here at SkinDC, the way we address the muscular component is a device called CoolTone.
CoolTone is a new FDA-approved treatment that uses electromagnetic stimulation to cause muscle contraction. Muscle contraction far more than you can ever achieve on your own. High frequency, for around 30 minutes, depending on the body location. And we use this for your abdomen, buttocks, and even thighs sometimes. And what this does is this high intensity really fatigues the muscle, kind of breaks down those muscle fibers so the body responds by, just like after exercise, building up muscle. So it's a great option to augment, to enhance any normal activity you do, physical activity, exercise, etc., to really enhance strength and muscle. And you're going to get muscle fibrils that you may not achieve, these deep muscle fibers. So when you're getting the treatment, it feels very unique, but it's a great way to tone musculature that we really haven't had. It's an extremely novel technology that we pride ourselves on being one of the first practices in the United States to adopt this new technology. And then Dr. Naga will talk about the next layer. So that's the muscle layer, which is the fat layer.
Multiple modalities to treat unwanted fat, but I think our most effective method is with CoolSculpting. So CoolSculpting's been around for a while. Many of you have probably heard of it, but just to go over it again briefly. The technology basically sucks in kind of bulges of fat into the machine and applies cold while the skin is protected, and that cold causes the fat cells to basically freeze, and as they thaw, that causes an injury to those fat cells that then signals your body to clear them away over the next 3 months. So we're often able to achieve around, on average, maybe about a 20% reduction in the bulge each time you get specific area treated, and that can be significant. And I think the people are usually the happiest when they do a combination of CoolSculpting and CoolTone, because as you reduce the fat and build up the muscle, that's when you really get that definition that everybody is looking for. And for that skin laxity issue that we sometimes see kind of compounding the problem, we have a lot of success with Ultherapy. Ultherapy is a device that uses ultrasound to create kind of injuries within the top layer of the skin as well as the deeper layer. And those injuries stimulate collagen deposition, which causes tightening and thickening of the skin. So that, along with treating the layers underneath, can often give the best result.
Yeah, so Ultherapy is almost like shrink wrapping the skin to tighten around that smaller, abdomen or thigh or whatnot. So at SkinDC, we really think about every problem, whether it's facial aging or body contouring, from anatomy. So with body, we talk about muscle, fat, and skin. We have it all here. So book an appointment, check out our body contouring department, and we're happy to see you. And we look forward to seeing you in our practice.